it's Friday and it's right before a holiday, and we have amazing special guests. And today it's going to be kind of unscripted, uncuffed, but we always try to do unscripted and uncuffed. But we have a superhero, and I feel really lucky that I might just be related to her because we have a bunch of Parkers in our family in North Carolina, but supposedly she's attesting that that's not true, that they're not from North Carolina. But if we've done 23andMe or Ancestry and Me, we just all might be, or we might be connected to Spider-Man. Who knows? Because whatever. But here today we have Jenna Parker. Just tell us a little bit about yourself before we do some deep dive.
It's great to see you again. I am Jenna Parker. I'm the chief of staff at Healthy, which is a SaaS company that's an EHR, patient engagement and scheduling platform. That's how we got connected. In a previous life, I was a professional triathlete for 10 years, and I also starred in a film on sci-fi. So I guess I'm a woman of many, many talents.
Well, this is super awesome. And we were in the green room, not that it's green, but we've kind of had a good conversation about everything and anything. And I've gotten her permission. At any point, you can say, stop, nope. But we are going to dive into women's health, like why women's health is important and what that means. And, you know, I am not able to speak to that other than, well, I am as a parent. I have a 14-year-old. So but from that perspective, and then also have a wife and everything she sees as a teacher in education. So anyway, where do we want to talk? Like, let's start.
Yeah. So, I mean, women's health, obviously I am a woman, so it's important to me there. But I think as I've gotten older, I've just become more aware of some of the disparities and inequities. One of the things that really brought this to light for me was a couple of years ago, I made the decision to freeze my eggs. When you're growing up and you're young, you have these visions in your mind that like, I'm going to find my soulmate when I'm 28 and I'm going to get married and we're going to have 4 kids. And I've obviously led a very untraditional path in my life. And all of a sudden I woke up one day and I'm 35, 36, haven't met my person and sort of want to protect my options. And so knowing the science behind fertility and egg freezing, I knew that my best chance of having viable eggs was to do so before I turned 38. So I did 2 rounds of egg freezing. Actually, the second one, I finished about a week shy of turning 38, the magic 38. So, and that process was just really eye-opening for me. And I learned a ton about, not only that process, but also just the things that like we aren't doing and the things that we should be doing. And you saying that you have, a 14-year-old daughter, I feel like as women, we need to start educating ourselves about what the questions we need to be asking sooner.
And I feel like there's so many things that are important in this topic, not only the 1.7 average population. We're like, our population is decreasing everywhere. The only population that's going up globally, I guess, is Africa and a few others. But I mean, just really, we need people in the future. We're not going to be around.
Yeah. And I think a lot of that has to do with, right, a lot of women are choosing to delay having children until later because they want to be able to have a career. And we're still in a situation where childcare too is extremely unaffordable. And so women are forced to make decisions about taking time off away from their careers. And if you're doing so in your late 20s and early 30s, right, and then you try to step back into the working world, it can be really detrimental to your career, right? Like women have a lot of trouble going back to work if they've taken significant time off. So if you choose not to, right, and you're sort of pushing that end date, then what you run into is the sort of fertility crisis, as I would call it. And the truth of it is that it's not just a female thing, that a lot of times like the fertility problem is coming from the men as well. But the difference there is that health insurance covers men getting their fertility tested. Health insurance doesn't cover women getting their fertility tested, which is just insane to me, right? And also for women, right, it's a lot. Your window is shorter, and unless you are educated and you know the questions to ask, you could be 34 and your fertility could already have sort of started petering off before you're even aware of it.
Mhm.
And that's the kind of stuff that, like, we don't make it a habit when women hit their mid 20s, right, to get baseline tests so that they understand, right, these are your hormone levels, right, like this is how, like, this is your egg count, this is your follicle count, and to give them that information so that they can make educated, informed decisions. I, at this point, basically tell anyone who is thinking about freezing their eggs or considering, wanting to have children in the future, just freeze your eggs. Like,
Mhm.
just do it. If you're in your early 30s, just do it. Because it's one of those things that, like, once you pass the point of no return, you don't get a second chance. Like,
I love that you're saying that at age 23, 28. I think you're absolutely right. The only problem is healthcare, $30,000 for the average family of four. It must be like how the affordability must be awful. I mean, people are just trying to get healthcare. So what is the cost point to do that? It seems like that's the access is a big problem.
it is, and I definitely struggled with this when I was going through the process. I chose to use a more traditional healthcare institution, and I was sort of baffled by the fact that they also had a pricing model where it was like, if you freeze your eggs, you do three rounds of egg freezing in 1 year, then, like, each round got discounted, which, like, doesn't make sense
Mhm,
to me,
mhm,
because I'm like,
mhm,
are you not going to try as hard on the first round so that I have to come back and do subsequent rounds,
mhm,
right? Like, the whole idea that it's like, if you can do this process for $4,000, why are you charging me six the first time?
mhm.
So I definitely felt like there was a bit of sort of a money grab here as well, which is something that really bothers me. I know that there are companies out there, like Kind Body, that have been trying to revolutionize sort of the way that this is moving forward. Um, and there's another company that, has put out this program where it's like, if you want to store your eggs with them, if you donate a certain number of your eggs, you can store your eggs for free, which I also, no offense, take issue with, because it again becomes an elitist thing where if you have money, right, you're not being asked to donate your eggs, wherein you don't, then, like, you have to. So there's definitely a financial burden here. And I have friends who have literally job jumped to different companies that would cover cycles of
Mhm.
fertility treatment for them. So they will go get a job at a company, work there, do their fertility treatment, stay at the company
Mhm.
for a year or whatever, and then leave and find another company that's going to cover the fertility stuff again for them.
So I love that you're passionate about women's health. I think we all need to be passionate. I'm a man. I think if we don't support, health for men and women especially. I mean, I look at it right now also with it seems like a big thing as well is menopause and some of these other things. Can we wrap that all in and create a better health program? Are there companies that are doing that? Because it seems like it's a full, all these things that don't have to impact negatively the healthiness of women seem that they should be or could be tied in together. And I'm sorry I'm throwing another part
Yeah.
out, but I feel like there's been lack of resources, access, and discrimination, especially with what you said. I cannot believe that. What were you saying, that a men fertility is covered for men but not women? And I imagine the same goes on after, where you're starting to have menopause and those symptoms, which I'm not going to speak on. I'll let you speak on. And I don't mean to hijack this conversation. I'm hoping to bring a more robust conversation.
Yeah, I mean, I haven't done as much looking in sort of the menopause phase of the female journey, but you are starting to see companies that are stepping up, and they are specifically targeting, that time in a woman's life, because it's not something, it's like this hush hush, nobody wants to talk about it, right? Like, if we don't talk about it, maybe it doesn't happen. And women are going through all of these hormonal changes, which can be very
Mhm,
challenging at times with no support, right? And
mhm,
there hasn't been a lot of money put into research, and it's just so underfunded. And on the other end of the spectrum, like looking at, for example, for your daughter, right? Like a lot of young women get put on birth control. And I ran into an incredible female founder who has started a company that essentially they can figure out what birth control you should be on based on like your blood type and your DNA and sort of who you are, because not every birth control is created equally, and you can have really bad side
Mm-hmm.
effects. For people who get migraines, right? Like you
Mm-hmm.
should be on a combination birth control, but a lot of people don't know that. And a lot of doctors aren't asking the right questions.
Mm-hmm.
And so really what it is that it is a full spectrum from very early days, right? Like getting these young women set up so that they can be, put on the right medications that they want to be put on, in a way that's going to enable them to flourish. They need to have the access to the information they need early, get baselines early so that they can make informed decisions, right? We've got to get healthcare to start covering some of this fertility stuff, because to your point, right? If fertility is really a problem, then, and it's coming from both sides, but if it's
Mm-hmm.
really a problem, we need to find a way to encourage women, especially women who want to have careers, right, to be able to afford to go freeze their eggs, right, and to have that, extra, I was not supposed to call it insurance, but that sort of extra insurance that when they do want to have a family, right, they can. And then we need to be looking at the other end of the spectrum,
Mm-hmm.
right? What happens after all of this, and how do we support women into like the sunset years of their life?
Mm-hmm.
And I think people have started to talk about the fact that like even prescription medications and dosages, right, are built around men. The research is
Yeah.
designed about men. So it's like, even when I'm
So,
taking Tylenol, it's not for a woman. Like the
so,
dosage is
so
not.
Jenna, I think I'm sort of trying to the Louisiana, what was the law? Something just in Louisiana that one it's now dangerous. I mean, with what did you see about that birth control pill, the whatever it's safer than Tylenol, that now there's a law in Louisiana. Did you just see that pass a few days ago?
No, I can't, honestly, I can't. I can't keep up with
Yeah, no, I hear you, but I'm
women,
just, but
the laws
the
going
it's that
through
I
for
forget.
embryos or
Yeah,
children.
no, I hear you, but I'm just saying that that's really scary that they're using laws, not medically, for political reasons
Yeah.
to prevent access. But I really think right now the healthcare it's so problematic, and I do really think we need a more robust from 12-year-old to 80 something, the whole span for women, because traditional treatments sound problematic with hormone for what, and I don't know as a male, but just I am worried as I'm doing my health with statins. When I hear certain research that statins only have a 4-day extend of life from a really well-known researcher, and it's just like, are you kidding me? Some of these like gold standards, when you see where they're funded, and I think the same problem is our information and access for women with hormone treatment. Is there a better way to do full wholesale and then also treatments in different ways? So I'll stop there. I just wanted to kind of reset.
Yeah, but I also think back to sort of, leaning into the politics of it, right? Like we got to stop politicizing women, like
Hmm.
period, right? Like the number of laws and the amount of time and resources and energy that have been spent in the last couple of years around, is an egg a viable child, right? Like should women be able to choose? Like we have now taken women, and it's like their health and their fertility and their childbearing has become like completely politicized, right?
Hmm.
And like it doesn't belong in politics at
Hmm.
all anywhere. Like we are just talking about the health of people here and the
Hmm.
safety of people. And that doesn't even get into when you go into like minority communities, right? Like
Hmm.
Black women, their rates of death in childbirth are
Hmm.
still like through
Hmm.
the roof. And this is something that like in 2024, like we shouldn't be talking about. Like it's crazy.
But Jenna, I feel like we need to create a moderate conversation where real normal people like you and me can probably agree that these are the issues that we all can agree about. We're getting people on the farthest of farthest, both polarization. And I feel like we need some sensibility, and we need to have these conversations, because when I
We need to
think,
have the conversation.
yeah, yeah,
Don't know that it belongs in the it shouldn't be for votes, right? Like, this should
okay,
be political, like, I'm taking
mhm,
this stance and putting these laws in place because I wanna get votes and I wanna be
yeah,
elected into office. It should be like, let's sit down and get the top hospitals, the top payers, the top providers, right? Like, let's sit down and figure out how we're gonna get some of these great drug companies to invest money into
yeah.
research on women, and like how
Well,
drugs
I
impact.
I feel like, I mean, this is the biggest thing, 232, with social media. If we really care about health, we need to talk about that with younger women that are being sexual, over. I mean, that's just the worst thing, with bodily harm, all the things that are being forced upon. I mean, that's my thought, is that we have a part, we have such big power with tech, that we can't have conversations like this to put things in place. I mean, a child, I think, should not have a phone. I mean, I guess it's a 13-year, but to me, that's the biggest. If we want to do more health or good to protect our children and our women, we need to have real conversations about that, not just Mark Zuckerberg one day to say he's sorry.
Yeah, and there what they're being fed and what we're all being fed, right, on social media. I mean, young women today, I can't even imagine growing up today. I am so grateful that I, grew up in the early 90s when phones were like, you played Snake on your that was my favorite phone, the little like these girls today, right? Like, they're being fed these images of like women that are super skinny, or women that
Mhm,
have had like butt implants, or like,
mhm,
tons of work done on their faces. I mean, the amount of women in their early 20s who are dramatically altering their appearance, it's quite frightening, right? And sort of thinking about these diet fads, and it's like we aren't having conversations about
mhm,
real things, right? Like,
mhm,
what they're looking at and what they're being fed and what they're being taught is like normal and aspirational is
mhm,
plastic. It's not real, it's plastic.
mhm, mhm,
And I will lose a lot of fans by saying that, like, I think the Kardashians are one of the worst things that ever happened
mhm,
to humanity. I
mhm,
mean, the way that they have changed how girls think that they need to look and act and dress, and move the focus off of like the deeper important issues. Um i- it's it's really sad, in my opinion. And
mhm,
to your point, right, we need to be having real conversations with girls about the real things that they're going through and the
mhm.
real things that matter, and
Yeah.
not about, how many likes do you
Mhm,
get, and can you airbrush your photo, can you
mhm.
use AI to like make yourself look like
Yeah.
it's there's
No,
there
Jenna, if you're gonna say Kardashian, you're gonna have to say Mark Zuckerberg, because there is no Kardashian if
well,
there's no,
he
if Mark Zuckerberg.
I did go to college with him. He lived down the hall from me.
Well, and what was he doing? Hot or not? I mean, that's his aspirational thing,
I
right? I
was on
mean,
that I was on
hasn't really
that
changed
website.
much when you really think about it, Jenna. He hasn't changed his business model, just got more
Well,
users
he
engagement.
didn't invent Instagram, he just bought it. So right? But look, a lot of these social media platforms, I know we were discussing this sort of beforehand, but right, it terrifies me that there are places where you can post images that disappear, right? There is no accountability for your actions, right? It is pulling people into sort of dark behaviors and things that they shouldn't be seeing.
Mhm,
And I frankly, I may be a little bit old school. I always joke, if and when I have kids, like, there will be no cell phones at home. They won't have phones till they can drive a car. We will have a landline so that I can embarrass them the way my parents embarrassed me, right? And the argument is, oh, you're going to ostracize your kids. How will they get in touch with you? How will they get in touch with me? Everyone else has cell phones. They can memorize my phone number and call me.
mhm,
Um, and I just think that, like, there is a point at which too much information
mhm.
is too much
Yeah.
information, and it's bad, right? It is not enabling and empowering these kids to grow up in a healthy way. It is putting these images and ideas and idealization in their head around like who they should be, what they should look like, how they should act, the way that they should dress, right? And instead of that being informed by the people they should be looking to, like their actual close friends, their family, right? The people that they can trust in their lives, that's being fed to them from sources that there's no real control over. And the negative impacts, and I can't fully speak to this, but like the negative impacts that I've seen on young women, right? Like it can be for life. And I've done a bit of work as well with sort of brain health in athletes and identity and depression and addiction and suicide and on those topics, right? And you can't help but think that all of this ties together, right? Like these athletes now, not to go on a tangent, but they're facing like the NIL stuff, right? And they're getting paid now for their likeness and their social media and how many followers they have. It's like these are kids that should be in college learning, right? They should be getting educations. And instead, like, it's like, oh, well, I need to, perform this way at sports and I need to make myself, you know, I can't think of the right word, like sellable to a company, right? Like I need to be marketable so that they will pay me and I can make this money. And everything has become very transactional. And I really think that a lot of the important conversations are being missed because of that.
So I really feel like we need to collectively, more of us, just like you're doing. Of course, you are the chief of staff at Healthy. I know you're doing some amazing things that in this space, but it seems like we need to have more grassroots. And I don't know what it is. Like I want to get more involved, whether it be at the school level with my child, my daughter. But we need to have more of these conversations. And I do think it's a 332. Like, how in the world is big technology has no regulation or no accountability and no liability? And I don't mean to, but to me, there needs to have some sort of, and I mean, there is a lot that we all agree upon, but it's just, they're too powerful. And to me, it seems like tobacco right now. 50 years ago, we all knew smoking. And now the scariest thing, marijuana is not good for you. You smoke marijuana, you inhale it, and it's going to cause issues with your lungs.
But
it might.
Not just that, fertility. Men have no idea.
And now it's like, because there's so much money in pharma and all this other stuff. And it also 18 to 30-year-olds are highly likely with the THC levels to have schizophrenia. Come on.
Yeah. And I mean, again, back to the fertility thing, right? Like it impacts the quality of male sperm, the shape, like it changes your DNA. And I think people don't realize that. Right. So all these young guys that are out there smoking marijuana and then they get to be 35 and they're like, cool, I want to have kids. And all of a sudden, like they've got swimmers that are upside down and backwards. Right. And so there again, right. Like, but you know what, we're going to point the finger at the women. It's going to be the woman's fault first. So yeah, I mean, I think in my opinion, it's having the hard conversations with your family, right? Like sitting down and not being afraid to talk to your 14-year-old daughter and to talk about a lot of this stuff, right? And to say like, look, when you get into your early 20s, right? Like, let's talk about how we can make sure if you're thinking about wanting to have kids one day, right? And it could be at 35, it could be at 40, right? Like there are amazing things where we can now, sort of postpone that to some degree, but like, let's get baselines for you. Let's make sure you're educated. Let's make sure you understand, right? Like the birth control you're picking, right? Like what are the risks versus the rewards of using non-hormonal versus using a common, like, right? Let's actually talk about this. Let's talk about what you're seeing on social media. How does it make you feel? Right? When you look at these women, right? Do you see yourself, right? Do you feel like you need to be that person, right? And how does that impact the conversations you're having with your friends? Or, do you notice that, in interacting with boys your age, right? Like, I think you have to, as adults, right? I think the only way to fight this is to face it head on and to not just sit back and like, let big tech do what it's going to do and sort of accept it. I mean, I think we all need to realize at the end of the day, right? Money is power and nothing's going to change because when you, again, go back to politics, it all goes back to politics, right? all these people are paying plenty of money to make sure their candidates get in office. So you think that the government's really going to go in and put major restrictions on the companies that are essentially funding the government? I mean,
Mhm.
just have to take a step back and realize like it's all interconnected, and hopefully again we get to a place where people do realize that some of these things that we're sort of turning a blind eye to today, the way we did tobacco for so many years, right? It, hopefully, we'll get to a place where we don't. But for the time being, I think it's when you talk about grassroots, I think it starts at home, and it
Mhm.
starts with everyone not being afraid to sit down and have the conversations with their own children and their own families.
Yeah, I put TikTok on there because I think really it's fascinating how they're going to divest that only so a bunch of people can invest in that and acquire it here. That's what I'm seeing, and it's just too powerful. You will see in 6 months to whatever. It's too much information and too powerful. So that's my take on TikTok today.
I don't have TikTok. I will never have TikTok. I don't. I drew a hard line. I barely have any social media, to be
Yeah.
honest. Also because there's so many other, like, pick your head up out of your phone. There's so many other
Mhm.
things to go do, right? As a kid, I
Yeah.
was outside running around, playing sports, I was like in the world. And I think too much time is being spent with faces and
Mhm.
phones and living. You're kind of, I mean, when you talk about like the metaverse, right? Like we're already kind of there. Like people are not
Mhm.
living in their realities. They're
Mhm.
living in this version of people's white picket fence lives, right? Like if you go on
Mhm.
my Instagram, right? Like I post cool pictures of me doing cool stuff, but guess what? Like
Are we friends yet on Instagram?
probably not, but, like, I don't post me, crying in the corner after my breakup, right? Like, you're not gonna see the, like, crap from my life on there because people that's not what we talk about,
Yeah.
right? We want everyone to think that our lives are, like,
Yeah.
perfect and beautiful
Yeah.
and tied up in a bow, and I think, again, like, realizing that that is not reality and, like,
Yeah.
picking your head up out of your phone and living in reality is, like, the first step forward.
Well, I'm so glad. Unfortunately, we don't have Peter Parker here today, Spider-Man, but we have, I guess, Peter Parker's soul sister, Jenna Parker, who's actually a superhero, and we
And
have
I
her.
could I could be Spider-Man. No one has ever seen the 2 of us in a room together, so
Oh, I love that. So that's like a pro women health thing. Really? Why does it have to? Why it should be Spider-Woman? I've never seen Spider-Woman. Is there a Spider-Woman? That's so sexist.
maybe we just assume it's a man and it's actually a woman. I don't know.
Yeah, I think so. Well, this is really cool. I know you have so much patience for me and love. I feel it because you're like 2 minutes before you're like, what the hell are we talking about? You
Look, I
know?
got a lot of hot takes. Hopefully I won't get too much flack for this, but I think, I think a lot of times we take too many things as sort of like this is the way that it's always been or this is the way that it is and there's nothing that we can do about it. And I think the big thing, right, is to step back and to start asking questions, to
Mhm.
start having the conversations and to know that like there is always more and better and different that we can be doing and we just have to be willing to go do it. Um,
Mhm.
and I know we're kind of coming up close to time, but like I think my sort of big push out there would be to any woman that may be listening to this, right? Is if you are considering having a family, I don't care if you're 20 years old, you should go get informed about your fertility. And if you're in your early 30s, even if you are in a happy, healthy relationship, right? I would encourage you to go do a round of egg freezing so that you have that and get that information and sort of have that for yourself to empower yourself because you absolutely don't know what's going to happen. It's fertility and having families and family building is so unpredictable and can be such a long and winding and bumpy road that the earlier that you are proactive about it and sort of instead of stepping back and being willing to be reactive to it, the better that you're going to set yourself up so that you can have those things that you want to have in life.
Yeah, Jenna, you're awesome. You're an awesome being. I hope I really appreciate you joining us today. I hope you found this pleasurable.
Absolutely. I'm happy to chat about all things. I've got hot takes on a lot of stuff anytime. I know we were joking before, but like I am single. So,
All
you know,
right. Yeah. So So we want we are not Planetary Health First, Mars Next has a lot of offerings, more on the media.
Now
So,
matchmaking.
but man, Jenna is so amazing. Definitely, I'm glad to hear that anyone that's out there, man, you got to connect with her on at Healthy or whatever. Anyway, I'll stop because I'm really sounding bad now. So.
Well, it's always a pleasure to see you. Thank you for having me on. I'm happy to join you anytime. And I think it's amazing that you've got this podcast and you're talking to so many incredible people. And I know you said you're coming up close to 100 episodes, which is it's a huge milestone and achievement. So congratulations on that. And let's get back together before you hit 200.
Man, I really appreciate it. And I really am trying to do good. I mean, you don't name a show a mouthful like Planetary Health First, meaning, women's health, men's health, all health, people's health, global health, right? And maybe we'll have to deal with Mars next, but I'm not worried about it. That's maybe next generation. And so I would say we're at that point now. So